So thank you all for joining us today for our second policy platform webinar. Today we'll be talking about the increased number of smoke-free homes and workplaces section of the policy platform. Go ahead and move to the next slide, please, Treble. So we're going to do meet the host. I'm going to introduce myself. So I'm Courtney Bennett. Hello, my name is Courtney Bennett. I'm a member of the Quartz Valley Indian Reservation. I am also the project coordinator for California's Clean Air Project, which is a tribal serving organization under TCCC. I am new to tobacco control within tribal communities, but majority of my professional career has been spent serving Native American communities as well as my lived experiences. Next slide, please. This is get to know our team, well, the TCCC team. I know you are probably very familiar with all of their wonderful faces: Nadja Ben, Ravina Soto, Samuel Black, Treble Vasquez, Tatiana Masters, and Jacqueline Peters. Next slide, please. So here is an overview of the tribal and tribal serving partners that are funded to work on the smoke-free home and workplaces section of the policy platform. We have 11 funded tribal partners and 2 tribal serving organizations. Next slide. Before we get into the remainder of the webinar, I want to talk about traditional tobacco versus commercial tobacco and just ensure that we're aware today in this space that we're referring to commercial tobacco and not traditional tobacco. I'm pretty positive most of us have seen this graphic, but traditional tobacco is a very pure plant. It is not altered. It doesn't have toxic additives like commercial tobacco or any harsh chemicals. It is usually used as a cultural process for prayer and ceremony procedures, whereas with commercial tobacco, it's really only used and intended to be used for sales and profit, and it's a product for revenue. Traditional tobacco is a medicinal plant. It's used for healing and pain relief, and very, very different from commercial tobacco, where unfortunately commercial tobacco has targeted our tribal communities, including our tribal youth, and has kind of made a villain out of a very sacred and healing plant. So next slide, please. I've seen a question in the chat, Ravina. They want to know if that graphic's available for public educational purposes. So we'll keep moving along. So with some quick statistics here, we have American Indian adults have the highest cigarette smoking rate, along with the highest flavored e-cigarette use rate. Our cigarette smoking rate is at 19.1%, and our flavored e-cigarette use rate is at 18.4%, which is higher than any other ethnic group. Next slide. American Indian tobacco-related health problems. So commercial tobacco has severely hurt our community. Its direct impact on health is asthma, heart disease, lung cancer, and chronic obstructive pulmonary disease. And the leading cause of death in American Indian and Alaska Native communities is cardiovascular disease and lung cancer. And then it also plays into the role of historical trauma. So Native communities have had a long history and lots of historical trauma. So with commercial tobacco, it often can lead to other forms of substance abuse and disproportionately high rates of depression and other mental health disorders. Next slide. So now I want to talk a little bit about the policy section itself. So our California partners have, I kind of forgot to mention this a second ago, but our California partners have set objectives to increase the number of smoke-free homes and workplaces. So a lot of our policies are focused on smoke-free households through voluntary pledges, smoke-free policies for tribal-owned housing and health clinics, smoking and recreation facilities in other public areas, as well as smoke-free indoor workplaces or gaming and other gaming/leisure businesses. So smoke-free policies are good for tribal communities for many reasons. Reason number one, they reduce exposure to secondhand and third-hand smoke. So smoke-free policies protect the right to clean air by reducing exposure to secondhand smoke in public spaces, including work environments and multi-unit housing. And additionally, third-hand smoke pollutants that accumulate over time and industed on surfaces are reversed when smoke-free policies are put in place. And there are actually studies that demonstrate the effects of third-hand smoke and the pollutants and such in a study for a California tribal casino. Secondly, they reduce tobacco-related health disparities. So as I touched on in the previous slide, it really affects our Native communities, and the smoke-free state level policies and their positive impacts on health outcomes are unfortunately not felt equitably across communities throughout the state. And they can be strengthened when implementing local policies and programs. So the work that our tribal partners are doing really gives us the opportunity to strengthen and reduce commercial tobacco-related health disparities. The comprehensive restrictions that can be put on workplaces and homes are linked to reduce exposure to secondhand smoke and third-hand smoke. As I just mentioned, increased smoking cessation rates, which I'll talk about here in just a second, and also the reductions in hospital admissions due to cardiovascular disease and the several other health outcomes from using commercial tobacco. Lastly, they can increase successful quit attempts. In our last session, last week really focused on cessation in the policy platform, but today it kind of ties into our webinar a little bit in this section. So smoke-free home programs for tribal communities are able to build on the values of respect, family, and intergenerational ties. And this allows households to have support when adopting voluntary smoking restrictions. So in combination with the cessation services and voluntary smoking restrictions, it can increase the successful number of quit attempts among Native American households.
Is it big?
Excuse me, if you're just entering, can you make sure you're muted?
Yeah, it's round anyway. Oh, yeah.
Rabbi, I don't know if you can do that, but we'll keep going. Next slide, please. So this slide goes over how our California tribal partners plan to honor tribal communities. So these are our tribal smoke-free policy practices. And on this slide, you can see that we have community values, which I kind of just talked about in our cessation section, is building on the values of respect, family, and intergenerational ties. We also look for advocates for change. So by promoting voluntary smoking restrictions, there's individuals in the community that, even though there isn't like a policy saying all housing has to be smoke-free, these advocates for change can really implement voluntary smoking restrictions within their home without needing a policy to tell them to do so. We also are looking for policy expansion. So urging smoke-free policies for places outside of the house, including the house, but also health clinics and workplaces such as gaming establishments and such. And then tribal leaders play a big role in this process. So if possible, recruiting smoke-free champions for leadership positions can help aid the process of implementing smoke-free policies in Native communities. Next slide. So now that we've kind of went through the overview of the policy platform itself, we're going to jump into two examples of work being done in tribal communities by our tribal partners. First and foremost is CCAP. When I introduced myself as the project coordinator for California's Clean Air Project. So we are a smoke-free tribal housing and gaming resource, and this is my homeland, my realm. So we'll do a quick overview of my project. Next slide, please. So California's Clean Air Project is centered on reducing commercial tobacco-related health disparities in American Indian communities. And when we are partnering with tribes throughout the state of California, we like to acknowledge our three main focuses and place our values on those three main focuses. So we are committed to promoting health equity in California tribal communities while simultaneously respecting and acknowledging tribal sovereignty as it exists. And we're able to provide culturally responsive educational services and materials that are reflective of the community that we're working with. And we understand that each community is different, and we do our best to accommodate our services to align with our tribal partner. And as you see on our screen, we have two service areas, smoke-free housing and smoke-free casinos. Underneath each section, there's a multitude of services that we offer, including indoor and outdoor air monitoring in tribal housing and casinos, which then in turn create air quality reports that are tailored to the community we work with. We produce educational materials, trainings. We have smoke-free policy support. So when drafting policy language, we can utilize our resources to make sure the policy is unique and reflective of the community. And we draw upon our tribal policy work groups to guide us in our work. Next slide. Oh, I think one of my slides may have disappeared, but no problem. The slide that I was going to share outlined kind of just our process for working with the tribal partner, along with what our most recent partnership was. And our most recent partnership was with the Redwood Valley Band of Pomo Indians in April of 2023. When we had our partnership there, we were able to install 10 air monitors, 2 of which were outdoors, and then 4 of which were indoors tribal members' homes. And 3 were in tribal members' homes. So it was a really successful outcome. I wish I had my slide here to show you, but it was an overview of our project. And we've had 5 air monitoring partnerships in the past year and a half. So we've been working closely with our other funded tribal partners to offer them air monitoring services that they can take back to their tribal leadership, and hopefully tribal leadership can make science-based informed decisions to create unique policies, smoke-free policies that are reflective of their community. And then next slide, please. So this is our next speaker is going to be Sergio. Sergio is the project coordinator for Coyote Valley Sacred Tobacco Project and the community engagement coordinator for Tobacco Free North Coast. He's also a father of 3, has 5 pets, and volunteers when he has time with the local fire department. He has been working in tobacco control for 2 years and has come to appreciate the opportunities that his role has opened for the Coyote Valley's youth. And by working with his community, he hopes to reduce the number of youth who use commercial tobacco and increase the community's knowledge and access to traditional tobacco. And as a project coordinator for CCAP, I've had the opportunity to work along Sergio. We provide air monitoring for his project and within his community, and it has just been a pleasure working with him as we advance our efforts towards smoke-free housing and workplaces. So with that, Sergio, I will hand it over to you.
Hello, everybody. Let's see if I can share my. Can I share that slideshow?
I integrated
Yeah,
your
pull it up.
slideshow. So it should
Perfect.
be just the next slide, Treble.
Okay, perfect. So, hi, everybody. Thank you all for coming. I'm gonna give just a brief overview of how we went about implementing our smoke-free home pledge, obstacles we ran into, opportunities we saw, and how we developed it overall. So we'll just get started. Next slide, please. So one of the things that was a huge plus for us is that Coyote Valley is actually a smoke-free workplace. So Coyote Valley back in 2016, I believe, passed an ordinance that made it so that employees can't smoke while on the clock. So even if they're on their lunch break, they can't smoke. It's a smoke-free work employee in all the vehicles, in all the departments, casino, admin, hotel, gas station. So that was a huge plus for us. And COVID was a blessing in disguise in the fact that it forced the casino to look at smoking a little differently, and they made it smoke-free ever since. And in speaking with the GM, as of now, there is no intent of going back to smoke-free, back to smoking, I mean. And no one seems to really say much about it. So he's kind of hoping that it kind of just, is forgotten about and people are just used to coming in and breathing fresh air. So next slide, please. So our goal for our smoke-free home pledge is to have 50% of on-reservation homes sign and adopt a voluntary smoke-free home pledge by 2025. When I first got here, I thought it was going to be easy. I was like, oh, slam dunk, no one smokes. But then being here, getting to know the community, I realized that while they're not smoking combustible cigarettes, a lot of them are smoking cannabis, and a lot of them are smoking vapes in the house, thinking that that there's no harm to it, there's no residue, there's no after smell. So once I found that out, I was like, okay, we're gonna have to do some work here. Next slide, please. So the first thing that I realized is that people were hesitant. There was a variety of obstacles that people kind of didn't feel very good about. So one was, it felt like we were invading their privacy. We were kind of trying to find out what they were doing, and it took us a while to kind of get them to know, to understand that it's all confidential and that we're not doing it to spy on them. We're just doing it to see how we could help them. Some people felt like we were judging them, like they would view negatively. So we also had to explain to them that by participating, they actually get more control over what we do with the data and what direction the project goes into. So that was probably the hardest part of it. And then people felt like they were losing their autonomy. So they wanted to just to live their life, and no one wants to be told what to do. So we did have to explain to them there's a voluntary smoke-free home pledge, and no one is asking them to change or do anything that they don't want to do. We just want to provide the education so that they can provide informed decisions for themselves, their family, and their pets. Next slide, please. So along with the obstacles came opportunity. So obviously there was opportunity to engage with the community, be able to interact with them, and get youth to participate was key. Once we started having youth involved, the community was much more open to what we had to say, especially when we were able to have a couple of youth participate in either like door-to-door like surveys or being at booths. It just makes it so that they're more excited about the program, they want to help the youth out, and they're more open to listening to what they have to say. And thanks to CCAP, Corny, and NASBA, we were able to do air monitoring. So we were able to educate people on their indoor air quality, what can be an exposure source. People were very surprised to find out that like cooking, candles, air fresheners, everything can affect your air quality. I think people were very narrow-minded at first, thinking that it was just smoke, like smoking or wildfires. And as they learned more, I noticed that people were much more cognizant about opening windows when they were cooking, or they told their other neighbors what they learned from this experience. And then one of the biggest things that we were able to do is educate people on, well, secondhand smoke, not so much because people knew about it for the most part. But third-hand smoke is something that most people just don't think about. And you kind of have to like make it a graphic visual like this for them to understand that even though it might be invisible, like there are over time signs that you can visually see that are almost impossible to get rid of at that point. So next slide, please. So while we developed our pledge, I wasn't sure where to start. So I reached out for help to CIMCC because they were also developing the Smoke-Free Home Pledge. Reached out to the Public Health Law Center and Colin, and he helped us develop our draft, which was like an official policy. And then from that, we changed it to like the voluntary smoke-free policy. We just decided to make an official policy first to lay down the groundwork if in the future we wanted to pursue that. And we worked also closely with the Cody Valley Housing Department in the development of this. Next slide. So this was like more like official policy for Cody Valley. It's not something that we moved on outside of this part because it's not a mandatory policy that we're pursuing right now. It's just a voluntary. So from this, we kind of changed it, adapted it a little bit to make it just easier to read, easier to understand, and to also highlight the use of traditional tobacco in people's homes. So next slide. So then we developed this. So I could read it, I guess. Due to the health effects of second and third hand smoke, the increased maintenance costs, as well as increased fire risk, the Cody Valley HHS department is working with tenants to voluntarily adopt a smoke-free home policy. Tenants voluntarily adopting this policy agree to maintain a smoke-free home. The policy applies to all residents, guests, and visitors within the tenant's home. Smoking means inhaling, exhaling, or burning any lighted, heated, or heated cigar, cigarette, or pipe, any other lighted, heated, or commercial tobacco product intended for inhalation. Smoking also includes the use of an electronic vape. So this one is not the one that we gave out. This is the one that we keep, so we need them to sign and date it, and this is what we keep on file. And then the next slide, this is what we give them. So this is on a cardstock, so they can actually frame it up if they wanted to. And it has this section over here on the right, kind of touching on the traditional tobacco. So tobacco is a sacred plant and should be treated with respect. It is a gift from the creator. It's important to honor the role tobacco plays in many Native communities. To protect my home and family from the harms of commercial tobacco, we pledge to not use commercial tobacco indoors. We will promote the use of cultured tobacco by using it with respect and purpose. So we made that so that people would also make sure that we're not demonizing all tobacco and that we're differentiating between the two. And that's kind of how we're going about it. Right now, we are in the process of collecting signatures from the community. And I think our next event that we're going to do is going to be on Thursday. We're going to have the Youth Coalition be out there collecting the smoke-free home pledges, as well as surveys for our proposed flavor ban here in Coyote Valley also. So that's it, unless anyone has any questions.
Wonderful, Sergio. Now would be a good time to take a couple questions if anybody has them. We're here. If not, we'll move forward and have a couple questions for all of you and get some feedback. So. I see some wonderful messages to Sergio in the chat. Awesome.
Yeah, thank you, Jen. We took our time designing it because we didn't want to go back and forth once we did it. So I'm pretty pleased with it.
Has
Thank you,
anybody
everybody.
framed them or not quite yet?
I don't think so. I'll definitely encourage people to do it more. I think now that we have a more established youth group, we have actually like 6 interns that work in the health department that are kind of being used as our tobacco youth coalition also. People will be, I think, a little bit more interested in what they have to present and probably more willing to actually frame it. And then the next step will be obviously to get them some sort of, we're supposed to have a window cling project, but in our community, we don't really have any front facing windows. So we're gonna have to change that to like a, like maybe like a little garden banner or a little garden sign or something like that. So that's gonna be the next step from here.
Awesome. Well, thank you for sharing. Treble, would you mind hitting the next slide, please? So this slide right here overviews, it's a comprehensive list of all of the tobacco control efforts that our tribal projects are working towards. It's a lengthy list. I don't expect us to be able to read it now, but this is just a very brief overview. I can leave it on this slide while I ask questions to the attendees. Let me see, I lost my question. Okay. Would anybody like to unmute, type in the chat, share something new that you learned today from this presentation, or how you will use this information in your personal or professional life moving forward? And don't be shy. Nobody?
Mona from Paula. I really like the inclusion of traditional in there. We were funded a little before Coyote Valley, and when we did ours, we did the pledge, but we didn't do add that traditional aspect in there, and it's really cool to see it. And if we get the opportunity, we're definitely going to incorporate that again if they don't mind us copying.
Sergio, do you have copyright?
No, if you want, I can send it to you and then you can have a copy so they could either copy the verbiage as it is or amend it and make it your own. I'll be more than happy to share that with you.
That'd be awesome. I'll put my email in the chat.
Perfect.
And Ravina, for that question earlier, do we know where that lives, or did you respond to it for the traditional versus commercial tobacco?
Respond to it. We can send it out by email.
Okay. Awesome. All right. I'll give it 30 more seconds of awkward silence and then and then we can skip to the next slide, Treble, and share contact information. All right, so if you have any questions that pop into your brain following this session and you want to reach out to anybody, we have Ravina Soto listed as the TCCC project coordinator, myself representing CCAP, and then Sergio as contact on behalf of Coyote Valley. So once again, thank you so much for joining us today, and there's no other questions. I will get out 3 minutes early. All right, hearing none, have a great afternoon, and thank you again. Bye, everybody.
Bye. Thank you.